If you're trying to decide between dog euthanasia and natural death, I'm going to tell you what your veterinarian may not, because it's probably too hard for them to say in person, and it's probably too hard for you to hear in person.
Welcome to Dog Cancer Answers, where we help you help your dog with cancer.
Hi, dog lovers. I'm Molly Jacobson. I'm the editor-in-chief over at dogcancer.com, where science writers, veterinarians, and cancer researchers give you better information today so you have no regrets tomorrow. I want to talk about dogs dying naturally versus euthanasia. And I want to tell you the plain truth as I understand it, and I have experienced it. I want to make this really short because it's a terrible subject to talk about. And I know that if you're watching this and you're contemplating that decision, it's not a comfortable time for you, and it's very, very hard. So first, I always have to say, I am not a veterinarian, and this is not medical advice. I'm just a dog mom like you, but I've been writing about and thinking about and researching cancer since 2007. So I guess I'm a knowledgeable layperson. Okay, back to euthanasia. If you're thinking about it, I've been there myself, and here's my dog cancer tip for today. Don't think of euthanasia as giving up on your dog or as choosing the moment of your dog's death. You can't actually choose the moment of death anyway. That's impossible because dying is a process. It's not a moment in time. It's a process that itself happens in stages, and it doesn't happen all at once unless it's a real emergency, like you're hit by a car, especially when the cause of death is chronic, like cancer. Dying happens little by little over days or weeks or sometimes even months. So if you are being offered euthanasia by your veterinarian, what they're really talking about is not choosing the moment of death specifically, as much as being able to control the circumstances of your dog's dying process, which is happening in stages. I don't know if you've ever sat at the bedside of someone, a human or an animal, who is dying. We imagine that what we'll see is a very loving and peaceful experience where the breaths just get softer and fainter, and then they'll just stop and we're with them and it'll be very sweet like it is in the movies. Or we imagine a natural death is finding our dog curled up in their favorite sunbeam and they've died in their sleep. And that's a lovely thing. And it does happen. And it's happened in my life. I've seen that. But just as every birth is unique, so is every death. Think about that just for a second. Ask a mother, a midwife, or any doctor who's seen more than one birth, and they'll tell you they are not all the same. It's unique to the individual. And death is also unique. It's unique to each individual. And you can't always predict what it will be like. I can tell you that every death I've seen or been present for has been very different from every other death. And being able to coerce or change the circumstances of the death so that they're as comfortable as possible is what veterinarians are really offering you when they offer you euthanasia. Because here's what many won't say to an upset dog lover who's already overwhelmed, already grieving, and this is like the worst day of their life, because I know it has been for me. What many veterinarians will not tell you is that a natural death does not equal an easy death. It does not equal a peaceful death, and it does not equal a pain-free death. Death can be painful, and because it happens in stages over a long period of time, it can be long and painful. If your veterinarian is offering you euthanasia, it's because they think this process of dying is already underway. When it comes to humans and dogs, we look for ways to maybe reverse it, right? Like organs can sometimes recover their function enough to give us more high quality life. That may be the case for your dog. I'm not telling you to give up on your dog What I'm telling you is that there is a point past which it's hard to reverse, and then another point past which it's impossible to reverse. And when it comes to humans, we offer as many comfort drugs as possible. When we realize we're past that point, right? We offer as many comfort drugs as possible to those who are in their dying process because it can be very hard. It hurts. So we don't want them to suffer. So we offer things like morphine and the little button that they can give a little bit more when they need to up to a point. That's because every cell in the body fights to live. That's what it does. So death is a struggle by definition. And every struggle is unique to that person, that individual, that dog. And struggle, by definition, is hard and stressful, both for the animal and for you. And so euthanasia, where first we put the dog into a deep sleep, so they're not aware of anything, and then inject a barbiturate, it stops the heart, so they're already asleep, and they're not feeling anything, and they're not aware of what's going on when the moment of death happens and their last heartbeat is taken. We're sparing them suffering. No death is kind. I've been in the presence of dogs who've died naturally, and I've been in the presence of those who've died of euthanasia. Neither are easy to witness for me, and I would not choose for anybody to die if I had my magic wand operational, which I don't. I offer this perspective to you as just something to consider when you're thinking about your dog's inevitable death. It's hard truth, isn't it, that death is inherently a struggle and almost always painful in some way. And it happens over a long period of time, or it can, and not just in one moment, not just in the moment that the heart stops. So when you're thinking, oh, is it too soon or too late? Remember, you can't choose that moment anyway. Even if you make an appointment for euthanasia and go through that whole process, there's nothing about that where you're choosing the exact minute that the heart stops beating. The heart stops beating when the heart stops beating. That is unique to your dog. So rather than thinking, is it too soon or too late, the real question, or the question that I suggest that you think about, is how much control do I have? And is there anything I can do to increase the level of control? That's what your veterinarian is really offering when you're being offered euthanasia, is some degree of control over the circumstances in which your dog's death happens. I'm not going to tell you my death stories because honestly, I don't think that's possible. Whether by euthanasia or by natural death, the miracle of death, and I do experience it as a miracle, it's the passing of great souls from the physical body. That is just awesome in the original sense of the word. It fills me with awe, and I cannot really put it into words. I don't have the words to convey it. I can only tell you that the pain and trauma of losing someone you love at the moment of death is enough pain and trauma for both of you. All the other suffering that might come along with a natural death might be optional. If you can avoid suffering, it's worth thinking about it. And because death happens in stages, not all at one time, you might think of this as a time when your dog is already started on their process and you are simply easing their passage. You are simply helping them to make their last breaths, their last heartbeats more comfortable and less of a struggle. I personally find comfort in knowing that my dog's pain and struggle will end at death, even though my pain and struggle will continue, increase even as I mourn my dog. You know, I don't think mourning ever really ends. It just gets easier to bear. I know that I'm still mourning my dog, Lori, who died in childbirth when I was only 3 years old. But it comforts me to know that Lori and my dogs and my humans who have died, in my mind, they're all somewhere together, smiling at me right now and encouraging me as I deliver this hard message. It's hard for me to say, and I'm sure it's hard for you to listen to. Anyway, that's what I can tell you as a fellow dog mom and someone who knows this pain. Your veterinarian might not be able to say these things so directly to you because they're such hard truths to say directly to someone's face, especially in a professional venue. But we do our best, me and my fellow writers and veterinarian friends over at dogcancer.com, to tell those hard truths. And I hope you'll take good care of yourself during this time. We're all thinking of you. I hope you'll give your dog a cuddle from me. And if you would like to reach out, please comment below or join us in our Facebook support group. Thanks so much for watching, and subscribe to the channel to get all of our podcasts and more dog cancer tips like this one.